Hi, my name is Maria Thornton and my partner is Christy Lopez, and we're going to be presenting on occupational health today. So what is occupational health? According to the World Health Organization, occupational health is an area of work in public health to promote and maintain the highest degree of physical, mental, and social well-being of workers in all occupations. And all occupations include utility workers, oil riggers, healthcare workers, education leaders, teachers. It ranges for every industry. A field of healthcare made up of many disciplines dedicated to the well-being of employees in their workplace. Physicians and other occupational health workers are required to stay up to date on different regulations, and that includes OSHA, which is Occupational Health and Safety Administration, DOT regulations, which is Department of Transportation, and FAA regulations, which is Federal Aviation Administration regulations. The reason they have to do this is to ensure that everybody is fit for their job. So if you have a commercial license and you are a commercial truck driver, you have a Department of Transportation physical every 2 years, and you have to make sure that you are fit to drive that truck. Same thing with the FAA and pilots. Pilots undergo an exam every few years as well, and it's to make sure that they are fit to fly. And some examples of occupational health can include employee wellness, pre-placement testing, so it could be physical exams or drug testing. They also do random drug testing if that company requires it. They also perform the annual testing for positions related to the DOT, which I mentioned previously, in the FAA, and also law enforcement officers, firefighters. They all have to undergo their own physical exams every few years as well to maintain their status as a police officer or a firefighter. It also covers ergonomics, occupational therapy, occupational nursing, and occupational medicine. So the occupational medicine umbrella is like for physicians, and that's making sure that they specialize in work-related injuries and treating work-related injuries. That's all they do. And a work-related injury could be if you're a contractor and you swing a hammer all day. It could be that repetitive motion from the shoulder and the arm from swinging that hammer. So that would be considered a work-related injury. Well, what educational background is needed? So with occupational health, there are 3 universities that we found within California that offer occupational therapy degrees. We have the University of Pacific in Sacramento, and they have a doctorate in occupational therapy program. University of Southern California has a doctor of occupational therapy program, and San Jose State University has a master's in occupational therapy. So that's just a couple of the different degrees that you can get for occupational health, a doctorate or a master's. So some prerequisites for the occupational programs are very similar to prerequisites for like the nursing program and any other type of medical program. So you have human anatomy, human physiology, neuroanatomy, abdominal psychology, general psychology, sociology and cultural anthropology, medical terminology, human development, and statistics. Some important traits of an occupational health specialist. The first one, which is, in my opinion, the most important one, is good communication skills. You have to be able to communicate these injuries and treatments and diagnosis to your patients, to your nurses, and the rest of your team. So being able to communicate effectively is very important. And also you have to communicate this information to patients and making sure that they stay afloat on what's going on with their treatment and their injuries. Problem solving and critical thinking. Healthcare in general requires a lot of critical thinking and problem solving to figure out the best way to treat certain patients, especially if they have multiple diagnoses and they're different medications. You want to make sure you can think enough to figure out which medications can be taken with what. Ability to keep up with the changing technology. The technology has changed a lot in healthcare over the last 20, 30 years. Looking back to how X-ray machines and MRIs and all those heavy equipment were 20, 30 years ago compared to how they are now, it's amazing. The X-ray machines used to be very, very big and gigantic, and now they're little tiny things. You have a big camera and you're just sitting against a wall that helps with taking that image. So keeping up with technology, but it's not just the physical technology, it's the technology in medicine, technology in care, and also with medical equipment. And when I speak of medical equipment, it's more like medical devices, like a patient, if they need a brace or a sling. Casts have come a long way in over the years. So it's being able to keep up with the change and accept the change. A lot of people are afraid of change, so it's being able to also accept the different changes. And then being detail oriented. A lot of occupational health facilities will see workman's comp claims because of on-the-job injuries. And workman's comp paperwork is very detailed. So maintaining an organized filing system and maintaining the details of a patient's injury and treatment is very important in making sure that you are giving all the information that's needed for workman's comp to present to their insurance company.